Hello, this is Bob Byrnes, Mayor of the City of Marshall. This is another update of where our community is at with the COVID-19 response and management. And with me today again is Dr. Steve Meister. Steve, of course, is the Chief Medical Officer at Avera Health and based in Marshall, as well as Marshall City Council member. So I thank Steve for once again joining us. Uh, I will start today by talking a little bit about some of the things that have changed this week and we anticipate will change. Many of those things are as a result of the governor's executive order. As we all learned, the governor has extended the peacetime emergency declaration until June 12th. Also, the stay-at-home order has been moderated to this stay safe, which is really encouraging the practicing that we have been doing as far as social distancing. And we also were gratified to see that the governor will allow some of our businesses to begin to open beginning on Monday, and then anticipate other businesses may be open on June 1st. And we're all anxious for that. And I know our local business people are putting protocols in place so that they can open safely for not only their employees and their customers. Now, let me talk just a little bit about where we're at with some city operations. We have some things that will open. We have some things that have always been open, and we have some things that will remain closed. First off, our senior center, we anticipate that at least for the foreseeable future, that we will continue to have our senior center closed. One of the reasons for that is the governor's directive and the health officials' directive to limit gatherings to no more than 10 people. And of course, we have a population that frequents the senior center that is at an increased risk health-wise from the potential exposure to the virus. So our senior center will remain closed. Our parks and trails and playgrounds have always been open. We do want to stress that we do not sanitize our playground equipment between each use. That's simply not practical to use. So we continue to encourage users of our parks, parents that have children at the playgrounds to use your own judgment and perhaps bring along some wipes or whatever if you have concerns. And of course, wash your hands frequently and encourage your children to do the same. I would also say the same about use of our shelters, and we limit the shelter usage to no more than 10 people, but also know that our benches, our picnic tables, and that type of thing that are in our parks are not sanitized between each use. There are signs that are posted on our trails and parks that also have this same information. As far as our summer recreation activities, including ball and also our aquatic center, we will not be having those operations or opening our aquatic center until at least June 15th. And between now and then, we expect additional guidance from the state as well as our local health experts on what if we would be allowed to safely open and continue those activities. And so in the meantime, we're also kind of preparing some protocols for how could we safely have those operations, how could we safely have the aquatic center. And then the final thing that I would say as we move into summer, the grass is starting to grow. Our parks departments, our streets department will be mowing less than what we have in the past. In some of the areas that we do not necessarily need to mow, we will allow that to go back into grass. And an example of this would be some of the broad areas along our bike trails on the north side of town and between County Road 7 and Victory Park. There's some really big areas that really could go back to natural grass, and we'll manage that in a way that it will be natural grass, natural prairie, but the also will control any noxious weeds. With that, I'm going to turn to Dr. Meister, and he can talk about some update on the local management of the from the health perspective.
Thank you, Mayor Byrnes. So, from public health standpoint, right now in Lyon County, as of right now, 10:30 in the morning on the 15th of May, there are 22 cases confirmed in Lyon County. Lincoln County has 4, Murray County has 30, and Pipestone County has 9. With the restrictions being lifted in the state beginning Monday, as Mayor Byrnes said, small gatherings are going to be allowed, and some more businesses are going to be allowed to be open. This doesn't mean the safety and mitigation practices are being relaxed. In fact, as Mayor Byrnes said, it's even more important now as we're going to obviously become more coalesced as a population. So, again, the biggest thing we can do from a public health and a medical standpoint, continue to wash your hands, maintain your social distancing as much as you can. Immediate family and family members are the exception. Wear a mask when you're going outside. And again, the mask is not necessarily to protect you, it's to protect others. So, for instance, if I have COVID and I am an asymptomatic carrier, and we know that there are a lot of asymptomatic carriers, and Mayor Byrnes is wearing a mask, if we were within 3 feet or within that 6 feet social distancing boundary, if we violated that, and I'm right next to Bob, and I am an asymptomatic carrier, and we're having a conversation for more than 5 minutes, the likelihood of him acquiring the infection from me is pretty high. If I'm wearing a mask, it drops by a little bit. If Bob's wearing a mask and I'm wearing a mask, then the risk really goes down. And if we increase our distance from 3 feet, 2 feet, which we normally have in our normal correspondence and socialization, if we expand that over to 6 feet, the risk goes down significantly, almost down to less than 5-10%. Again, not zero. The best way to do it is like Bob and I are doing it now on Zoom, where he's in a completely different room far away from me, and I'm in a different room far away from him. There's no possibility of either one of us catching anything from each other there. Again, stay at home if you get sick. If you've got the sore throat, the fever, loss of smell, loss of taste, new onset cough, the body aches, shortness of breath, call the 877 at Avera. Stay home. Don't go outside. Don't go out unless I wouldn't even go out if you needed to. Have somebody else do it for you and come back. From the Avera standpoint and the local health services here in Marshall, we are going to be resuming the services that we had put on hold, and we'll start scheduling those patients that have the most pressing needs and ongoing needs first. Preventative care visits are also going to be slowly reopened up. Again, our clinic safety and cleanliness is extraordinarily important. So things are going to be done in what we like to call the next normal. If you come in and expect things to be done exactly as they had been before, you're going to be disappointed. We've got to all get used to being somewhat flexible. Everybody who comes into the clinic will be made, with rare exception, to wear a mask for the reasons I already stated. We're going to have our 6-foot distancing. All the visits are going to be at the Bruce Street campus for right now. And we're not sure if that's going to change. So just have some flexibility and patience, and realize that because everything has to be cleaned so much, appointments may take a little longer. We have to move at a slower pace than we have before, and that's because we have to make sure things are cleaned and sanitized in between patients. People will be screened before they come into the clinic. That includes taking the temperature, and if you've been exposed to anybody with known COVID, or if anybody's having possible symptoms of COVID that you've been exposed to, hand sanitizer is going to be available in all the waiting rooms. Testing is increasing. The governor has mandated that as well, and so testing options are getting more and more opportunistic, and we're getting more and more of those. And as we get more availability of that, the mayor and I will share that. We also have what I think is going to be the next normal. We've got virtual visits. So if you have not seen your provider within the past year, please get in, get seen, signed up for the Avera portal. Once you're on the portal, there's a lot of things that we can do, just like Mayor Byrnes and I are doing right now virtually. And a lot of things like colds, rashes, just a whole host of things can be done virtually. And if your provider determines that you do need to be seen in person, they'll talk to you at that time about it. So things are going to be starting to relax, and we're appreciative of that. This has been a hard couple of months for everybody, and we understand that, and I understand that, and Mayor Byrnes understands that. However, we still need to be careful and realize that this disease, as I've said in multiple scripts before, this is a covert virus. It affects everybody differently, from completely asymptomatic to getting really, really sick, intubated, and even dying. And you just don't know which one of those people you're going to be. Um, our most vulnerable are the older people over age 65 with comorbid medical conditions. We do know that. So those people especially should take really, really great care in staying safer at home, wearing their masks when they go out, making sure that we wear or wash our hands. And when you do wear the mask, don't touch the mask at all. You know, the mask should be worn. I'm going to demonstrate how the mask should be worn like this, and it's got to go up over the nose. You can't have your nose hanging out. And when you take it off, you can't have it hanging around your neck or up on top of your head or any place else. It's got to be on your face like I have it right now. And that's the best thing. When you take it off by the straps and you lay it down mask side out, hopefully on a clean paper towel or something like that. And then wash your hands with either hand sanitizer or soap and water after you've done that. And that's kind of the next normal. That's what we should do for masks. So that's all I have, Mayor Byrnes. I'll turn it back over to you for now.
Thank you, Steve. And let me close by just saying a couple of things. First off, as Dr. Meister said, this has been a difficult couple of months, and we certainly appreciate everybody's cooperation and looking out for not only their own health and safety, but also their neighbors. And I'm fully expect that will continue, and people will continue to be cooperative and watch out for each other. If we do have questions about the medical questions, refer to the Avera number. City questions, refer to our City of Marshall general number. Any questions that people have. And again, Steve and I will have these periodic sessions to try to share as much information as we can with the people in the City of Marshall. So with that, thank you. Stay safe.